Laura Garrett, I was reading through all of this coverage, and I was really focused in on the picture in Europe where they're battling this variant that is here now, and it is so bleak. And I had, through my own fault, lost sight of that covering the impeachment trial last week, and I put that together with Dr. Osterholm's warning, and I knew I needed to talk to you today to ask you what is coming.
Yes, well, the first lesson we have to take home right now is that if you look for it, you find it. Wherever we take a concerted effort to look for variant viruses, mutant strains, we're finding them. That we don't see more of them in America is simply a reflection of the fact that we don't do anything close to the level of scouring our genomic strains and sequences across the country compared to what our European counterparts and South African have been doing. The other thing we're finding is if you look in animals, you find it. So that South Korean surveys are finding house pets and all sorts of animals carry the virus and may carry mutant strains. So what happens when these strains emerge in a community? In the UK, it didn't just double, it tripled from the week before Christmas to now. And as taking over, basically, the whole percentage of viruses circulating in the UK, so that it's now up to about 80% of all infections with COVID in the UK are the B117 variant. In South Africa, it approaches 100% of that variant strain, which is actually worse than the British variant. We see variants emerging all across the United States. We've now had about 10, by my count, that are uniquely North American variants that have emerged. Plus, where we've looked for it, we've found the Brazilian variant, the South African, and the British. What we know is they spread super fast. And we also know that we've underestimated the pace of spread in general, so that we've tended to think of this virus as easy to control. But we just saw the case of Peter Diamandis, a very well-known sort of futurist and very popular leader of CEO innovation talks and TED Talks, that sort of thing. He has an annual conference. This year he said, no, we have to meet virtually. Some of his followers said, we want to come in person. They tested everybody every day, starting 72 hours before they convened. Everybody came up negative, and they had a super spreader event, and about half of the participants eventually turned up infected, and several have been seriously ill with COVID. So it shows you can't test your way out of it. You can't necessarily vaccine our way out of it. We need to keep wearing our masks. We need to take this darn seriously, Nicole.
So what you're saying seems to bolster Dr. Osterholm's warning, which sounded really bleak in light of this dropping caseload. But if I understand you, it sounds like any policy pronouncements about starting to, I think some states have removed their mask mandates. I believe it's the state of Montana. There is an active conversation about not whether we reopen schools, but how to reopen schools. Is this the right time for those policy shifts?
Well, from the very beginning, Nicole, every time I've been honored to join you on this show, I have said we don't know the kind of data we need to know to make these decisions. We do all our data collection in such a haphazard fashion, so willy-nilly. Drive into the parking lot and get your nose swabbed. That we don't really have the necessary tools to answer your question. So we're making policy choices that reflect more social and economic pressures than they do the science itself, because we just don't assess the science properly.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.